Hi, Jessica. How are you?
Good. How are you?
Great. I'd love to learn more about your practice. Can you give me an overview of the work that you do?
Yes, absolutely. So my private practice is located in Pasadena, in the old business district, kind of downtown area. And I work with clients individually. I work with couples, and I also work with families. The ages that I work with kind of range. So youngest age I tend to work with is about 13 or 14, pre-adolescence, all the way through adolescence, young adulthood, into late adulthood.
That's great. And what are some of the specialties in your practice?
So I have three kind of main specialties. So the first specialty that I have is working with eating disorders. So anybody who has a history of an eating disorder or is currently struggling kind of with active symptoms, or maybe with people who don't identify as having an eating disorder but struggle in their relationship with food or their body. I also work with a history of trauma. So anybody who's experienced either abuse or a traumatic event, I help you. I help work with those clients in terms of navigating that day to day. And then my last specialty, I would say, is family therapy. And I work with small or large families, multi-generational families. A lot of times I work with families that are having significant conflict in the home or difficulty communicating with each other. And because I've worked at all levels of care of treatment, from inpatient all the way down to outpatient, I also tend to help families kind of navigate and support somebody who is leaving either treatment for an eating disorder or who is leaving treatment for addiction, kind of reintegrate back into the home and back into the system.
That's wonderful. And what are some of the therapy approaches that you use to help people?
Sure. I would say that my general approaches are strengths-based, so identifying the things that clients are really good at and using those strengths to help build a life of meaning and purpose. I would say that I tend to kind of pull a lot from humanistic psychology, which is essentially helping to see the client in the whole of the client and everything that is working in their life or not. I work really collaboratively, so the client's going to really be the main leader in identifying the problems and coming up with solutions, and I help support them in finding a life of meaning and purpose.
That's wonderful. And do you have a message for clients seeking therapy at this time?
I would say that, one thing to remember is that finding a therapist is really hard and really difficult. And finding a therapist, we're humans, just like, clients are. So we're different. We bring our personalities and our history into this as well. I think it's important to know that if I'm not the right fit, if after kind of an initial assessment or a phone call, a client decides I'm not the right fit, it's really important to me that I help them find kind of the next step. Or, I have a network of clinicians that if I feel like I have a lead or somebody that might be really working for what they're looking for, then it's important for me to help them do that.
That's wonderful. Thank you so much, Jessica.
Thank you.